We are back on Fox 5 Weekend Live. I'm Julie Donaldson. Since we're coming out of the winter and going into summer, it means that we're going to be wearing different clothing to get outdoors. And maybe some people aren't quite comfortable with all of that because what I've learned living up north, sometimes we put on a winter coat, meaning a little extra, cookies, cakes, donuts, and pizzas. And we want to be able to work that off. We want to feel good about ourselves. But what is the best way to go about losing weight? Sure, you can go to the gym. Sure, you can watch your diet. But there's other things that can be of assistance as well to help us feel and look our best. So I want to bring in Drew Varano now of MedStatics of Drew Varano here. He specializes in making sure that people feel good about themselves. Drew, thanks so much for joining us.
Thank you for having me. Happy Easter.
Happy Easter. Medical cosmetic enhancements. That is what Drew Varano is with.
That's correct.
Okay, thank you. We'll get there. A little bit of a rocky start. So, Drew, one of the things that you specialize in is Renuvion. What is that? Because I've never heard of it before, but it's something that a lot of people are finding very helpful.
Yeah, it's a great new tool that came out in 2018, and I've been doing it since its inception. It's a minimally invasive procedure that I typically will use in combination with maybe about 40% of my liposuction cases. So it can be done outpatient where people have a 1 to 2 day recovery time. It can be done on multiple parts of the body, like lower face and neck, arms, abdomens, thighs. So it's an alternative for some people for a full excisional surgical procedure if they have mild to moderately loose skin. So with this GLP-1 phase that everybody's losing 20, 30, 40 pounds, even 50 pounds, we can help tighten that skin that before used to have to be cut out. I'm not saying it's a replacement for a traditional tummy tuck, but there's a lot of patients that are categories for this as opposed to a neck lift or a tummy tuck or a brachial or an arm lift. So it's a great procedure that I've been doing now for the last, 8 years now.
How does it differ from just a standard kind of the energy from a standard laser that you might be able to get?
So the beauty with this is it's minimally invasive. So we're going underneath the skin with the device, and we're laying the energy down to the layers of the tissue that actually need it. So when I do a procedure, it's typically done with, as I mentioned, local anesthetic. So there's small incision sites, 3 millimeters. So if you think of a pencil head as being about 5 millimeters, it's even less than that. Where if you want to use the term wand or the tip itself, which is smaller than the width of a typical straw, I go in underneath there and it's releasing 2 forms of energy, unlike other devices. So what makes this beautiful is it's using what's called helium plasma gas along with radio frequency. And those 2 forms of energy get in there and heat the tissue to 85 degrees Celsius, which allows the skin to basically shrink wrap in what's called the fibroseptal network of the tissue. If you lay down 85 degrees Celsius with a laser or any other type of device, that will tend to burn through the skin where the heat will transfer. This stays so focused into the area it was laid at, and that's what helps the skin contraction itself.
Okay, so I'm seeing here as well, there's a couple different things to try to understand the difference between. There's the Renuvion subdermal coagulation and skin resurfacing. What's the difference between the two and the recovery time for them?
Great question. So we don't do the skin resurfacing. That's kind of like a CO2 laser on the surface of the skin. And that really causes the top layers of skin to shed itself. So that's more like a topical laser resurfacing, and that's a different use of the same device. What we do it for at our practice is subdermally underneath the skin. So it's a different wand or a different tip, but the same base machine. And that's what we can do. And people don't feel anything because it's all local anesthetic. And typical recovery, a treatment will take, depending on which areas we're doing and if I'm doing simultaneous liposuction, but a lower face and neck really takes me 35 minutes to do. A typical abdomen area or arms or whatnot may take an hour and 15 minutes. But again, I do a couple basic steps. One, I numb you up with the local anesthetic. The second part, if we need to remove fat, we will do liposuction right then and there. And then the third step is tightening that skin, which they will see the effects pretty soon. Within a 2 to 3 weeks after the treatment, it continues to tighten up for about a 6 to 9 month period, and results last years. We typically will tell people about they should get 5 years out of the results.
And I was looking at some of the before and after pictures, and it's quite wild. I think a lot of people here, you get a little extra neck fat and it can take that away. But to your point, for people that have lost a lot of weight where there's a lot of extra skin, underneath the arms and the abdomen, is there a certain weight? Like when does it become this is going to be helpful versus where you said you need to do surgery and you kind of have to cut it out? What's that line?
Yeah, a great question. So it's really not a weight thing that that people have to watch. It's more of like the amount of laxity to the skin. And there is no one objective measure. We just say mild to moderately loose skin. If it's more severe loose skin, then they're going to probably need a skin excisional procedure. And typically, I say if you've lost more than 50 pounds, then you're probably best doing an excisional skin procedure. But again, it depends on the person, because younger people have more elasticity, whereas people, when they get in their upper 40s and above, they have less elasticity. So this is a treatment that probably will benefit them. But again, it depends on what we're starting with.
What about what parts? I know we talked about under the chin. I mentioned under the arms. We get this chicken flap here, the stomach. What other areas can you treat? And is there really anything that's off limits?
Frequently with the the neck, I'll do the lower face and neck in combination. Abdomens, love handles, inner thighs, outer thighs, arms, as you mentioned. They're the main areas that people will treat. And backs, I'm sorry, I forgot to mention that. And it works extremely well on back areas, as you may have seen some of the videos before and afters, as you can tell how it really tightens up that skin and basically shrink wraps you.
Complications, because there's always, no matter what procedure you go under, there's a certain risk. What do people need to be aware of?
So it is an actually very safe procedure because it's done with local anesthetic. So it comes with basically the same risks as local anesthesia liposuction, where we look for infections, which are extremely rare. Preemptively, we will typically put people on antibiotics prior to a treatment just to be prophylactic. We watch for what's called a hematoma, which is a collection of blood. So we don't want people taking any over-the-counter blood thinners a week prior to the treatment, such as Motrin, Advil, Aleve. You want to stay away from that. They're the main ones that we look for. You would think about burning of the skin because you're using something hot, but typically we're using it underneath the skin. And, in I would say roughly 800 Renuvion procedures that I have done, 800 to 1,000, I don't recall one case where we've had a superficial burn. As I mentioned, it's all heating underneath the skin where it's supposed to be.
With the plasma energy, which this is, are there other uses that you have for it besides just the skin tightening?
For this treatment, that's really all it's used for. And it's actually discovered, like a lot of other things, that we're using it in general surgery for other things. I believe cardiac surgery and OBGYN surgery. And then we're finding out the skin was tightening on top where they were using it. So that's kind of how it got discovered and how the ball got long. And when you alluded to at the very beginning, you were talking about the skin resurfacing. That's a whole different ball of wax and a different use, which again, we don't do that procedure.
When it comes to the liposuction and the GLP-1s, is there at one point where maybe, both go hand in hand? Have you found, or what are people using that are finding to be successful?
Yeah, that's a great question. There are some people who do the GLP-1s and still have stubborn areas of fat. And if they have those stubborn areas, manually taking out liposuction wise will help. Typically, they might have some, baby fat, I want to call that, from previous pregnancies or a little scar tissue underneath there that holds it up. My nurse always brings up the fact that, the GLP-1s will just shrink the fat. So it's like taking a grape and making it into a raisin, whereas the liposuction itself will actually physically remove those fat cells where they won't come back. So they kind of do go hand in hand. And again, it's case by case, obviously.
Okay. Look, this is a day and age where the GLP-1s are so popular. But some people are, wary of them. They don't want to get into it for whatever reasons. Lipo is still something that's out there, but I get it. I mean, looking at those pictures, if you've lost weight, just that isn't enough. Sometimes you want to be able to feel good when the clothes are off and that skin is sagging. This is a great way to make sure that you can get rid of some of that sagging skin. Dr. Drew Varano, thank you so much for joining us here.
Well, thank you for having me.
All right, friend. Talk to you soon.
Take care. Thank you.
We'll be back on Fox 5 Weekend.